Hi, Dave with Line Therapy here. I wanted to talk about something that I have going on that is something I'm going to be having surgery for. I have Hallux Rigidus. In other words, my wife calls these my horny toes, and it's because I have bone spurs on the first metatarsal phalangeal joint of my feet. I have that on both sides, and Hallux Rigidus is something that's actually fairly common in the population. And I'm just unlucky enough to have that. So I wanted to talk about what it is. I wanted to give an idea of the process of diagnosis of Hallux Rigidus and how I decided to have surgery. So if anyone else is dealing with Hallux Rigidus, follow along. I'm also going to do a pre-op video, a post-op video, and then at different stages of post-op, so you can kind of see what the recovery is like. I know that when I was looking at possibly doing surgery, I really wanted to know what the prognosis was, what the process was. And luckily we actually had a patient who had the Hallux Rigidus surgery that I had talked to. And knowing as a PT what I know about tissue healing and that, it kind of gives me an idea of what to expect. But it's a little bit different going through it yourself rather than someone that you're treating. So hopefully this is helpful. Let's talk a little bit about how we came to the diagnosis of Hallux Rigidus and kind of give some idea on what I'm going to do about it. So Hallux Rigidus, the term means a lack of mobility in the hallux, which is the big toe. And that's usually what we notice the most, is a reduction in the motion, the mobility of the joint of the big toe. And I definitely noticed that, and along with that comes pain. So as the bone spurs hit together, it blocks the range of motion, but it also causes inflammation and pain in the joint. Hallux Rigidus can also be arthritis in the joint of the big toe. So let me show you on myself. So it's this joint right here on both feet, which is fun, but I'm just going to show this side. So it's that joint, not this joint, that is associated with Hallux Rigidus. And rigidus because my toe doesn't move very much. And if we look at the motion here, if I'm pulling that back, we're getting to, what is that, about 30 degrees here on this goniometer. Normal with the big toe range of motion with extension, we should be closer to 60, 70, sometimes 80. Some people have 90 degrees of motion. I am stuck with 30 degrees, and for normal walking you usually need about 40 to 50 degrees. So I'm noticing that it's changing the way that I walk. Not that I'm limping, but I'm walking a little bit different because of that. I'll put some, at this point in the video, I'm going to put some x-ray pictures, and on the x-ray you can see the bone spurs that are in that joint. They look kind of like a shark fin, like a hook. That's why my wife calls them my horny toes, because they look like horns. They look like rhinoceros horns that are on that joint. So right here, you can't feel it because this is on a video, but right here on the side, on the top, you can feel the ridges of those bone spurs, and that's not necessarily as sharp as what it shows on the x-ray because there's soft tissue that's surrounding that. So it's not as sharp as that. It's not like it's cutting into my tissue, it's just blocking the motion. So as this bone here tries to slide past this bone here, there are bone spurs that are just blocking that from happening. And on the x-ray you can totally see that there's a lot of bone spurs, and what they're going to do is go in and just cut off the bone spurs and then look at the integrity of the joint and see if I still have cartilage in there. So the reason that I decided to do it at this point is I'm having a lot of pain. Like when I walk, almost every step I feel the pain because my foot won't go into that dorsiflexion, my toe won't go into that dorsiflexion. And I always said that when it started to limit what I like to do for fun, that I would go in and get it looked at again. I had an x-ray 2 years ago, and the x-ray that I had recently was much worse than 2 years ago. This is a progressive problem, it's a degenerative problem, and so the longer I wait, the worse it's going to get. And so this isn't just do more exercise, do more mobility and all of that. This is something that it's just going to get worse. So I'm going to go and get those cut off, get the horns cut off, and then work on the mobility. Physical therapy after hallux rigidus surgery is really important because it helps you to gain your range of motion back. The whole purpose of doing the surgery is to get mobility. And if you don't get the mobility afterwards, then you're just going to be dealing with similar problems. There are other things that can be done surgically. There are joint replacements that can be done for that joint. They're not great right now, so I'm hoping to buy myself about 10 to 15 years after. This is called a chelectomy, and after the chelectomy, hopefully 10 to 15 years gives it enough time where there's a good joint replacement that I can do, because I do have arthritis in that joint as well. So hopefully this kind of tells the story on this. To get diagnosed, you probably need an x-ray to make sure that that is what's going on. And then there's a clinical diagnosis where looking at range of motion and pain and all that fun stuff to decide whether or not you're a good candidate for surgery. And then surgery, from what I'm expecting, is about a 6 to 8 week recovery to get back into normal activities. And then exercise and higher level activities, we'll see how long that takes. So hopefully this was helpful. If you're dealing with the same problem or you have questions, just leave those in the comments and I'll answer those. And stay tuned because we're going to do more videos on this. Thanks for watching.